Okay, so the difference between a leap and a leap is one leg onto the other. The hop now is there's going to be a little bit more force production, so he's going to have to push off one leg and he's going to have to land on the same leg. So again, there's a lot more force production, but there's a lot less time to think. So this is really where the pre-tension and all of these preflexes, reflexes are really going to be tested. Okay, so Shane, same kind of concept. So a hop and stick. Again, the key thing here is Shane wants to jump off that. When they do a bad rep, they'll want to jump off quickly. Okay, already done an ankle there. Okay, that's it, and figure it out. Good. Okay, and then again, you can test them with your perturbation. Same thing with the hand drivers. Okay, so this time, Shane, I want you to go this way, reach transverse plane. That's it. So you can see this is quite difficult for Shane. So if I wanted to regress Shane with that, Shane, left hand reaching towards me this time. Okay, good. And then do that once more. So again, we're taking load off the inside of the knee. We're helping him with his hip. And you can see how solid that rep was there. Whereas if you go this way with your right hand in, okay, you can see that that's going to stress him a little bit. Now, I'm not too worried about that, but there's a little bit of practice there to smooth this out, so to speak. Oh yeah, so yeah, sorry. So Shane just had a groin tear about 3-4 weeks ago. Yeah. So again, putting load to that adductor, I think we found the rehab you need to do now.
Pain-free, just hard to hold.
Yes, exactly. So this is that part of the rehab program now that Shane really needs is, as you just said there, it's pain-free, but it's just hard to hold. So that timing is slightly off. When he puts load through this way and his adductor has to take the load, the timing between the adductor and the spinal cord is just slightly off. Okay, and that's what we want to smooth out. So that will be perfect for Shane. This level of loading, it's pain-free. So we could keep him at this level of loading at the moment. And I'm sure within 3 or 4 sets, he's going to figure this out quite quickly. Okay, so that's your hop and stick. As I said, use any of the hand reaches you want. Then we're going to move to a hop stick. So you might give your patient that. For Shane, he's probably at that level. I'd give him a hop and stick with that reach. I'd get him to go away and practice that for a few days. And then the next session, we'd go to a hop stick.